BioCon 700 is an ultrasonic residual urine volume measuring device manufactured by MCube, specialized in voiding dysfunction. Let's take a look at how to use the CubeScan BioCon 700. Press the power button to turn on the device. Select patient type. Lift up the patient's garment, exposing the abdominal region from the pubis to the navel. Apply an ample amount of gel to the probe head. Draw an imaginary line that extends from the navel to the pubic bone and place the probe on the patient's abdomen 3 to 5 centimeters above the top of the pubic bone. Now, make sure your patient looks at the ceiling in a correct position. Press the scan button on the probe or touch the scan icon on the screen for pre-scan. If you press the scan button again when the bladder is at its largest size, the residual volume will be calculated. Locate the bladder along the median on the screen as shown in the image. Press the scan button. Hold the probe steady while scanning. Press the right or left arrow key to check all 12 frames, and press the print button and confirm the exam results from the onboard printer located at the back of the device. If the scan is on target, the bladder will be shown in the center of the crosshairs on the screen. Touch ID tag as shown in the images. When finished entering the ID, press the OK icon. Touch the Save or Print icon to save or print out the result. There are Record, Play, and OK icons. The measurement will be completed after saving the data. To perform another measurement, touch the New Patient icon. Once you've completed the scan, wipe the gel off the probe and the patient with a clean tissue. So far, we have talked about how to use CubeScan 700.